Hello, good evening to everyone, or afternoon, wherever you are in the world. I'm Dr. Philip McMillan, and I've been focused on COVID 19, looking at it from the perspective of a viral mediated autoimmune disease. And within that framework, I'm going to be discussing one of the significant events that has occurred today. My title here is about the potential Nobel mistake. And what am I talking about? Is first, let's give congratulations to, I'll show the image here. This has been published just today in the press release on the 2nd of October 2023 from the Nobel Prize being awarded in Physiology and Medicine to Catalina Carico and Drew Wiesman. So essentially, this is a tremendous accolade. It's probably one of the greatest accolades that can be given to a scientist. And whilst I am very happy for the individuals who are involved in the research, I am very concerned about the institution of the Nobel Prize. You have to realize how significant this institution is. And I'll just show you quickly who this has been looking at. So, since 1901, between 1901 and 2022, Nobel Prizes have been awarded every single year. So we have 2023 here, but you can see in 2022 the Nobel Prize for Physiology and Medicine. So you have different categories: physics, chemistry, physiology and medicine, literature, and the Peace Prize. But in terms of physiology and medicine, in 2022, they were looking at the concerning the genomes of extinct hominins and human evolution. That was in 2022. In 2021, we had here for physiology and medicine discoveries for receptors and temperature and touch. So you can see each year there's a Nobel Prize in physiology and medicine. This one was for the discovery of hepatitis C virus. And you can go down into 2019, discoveries of how cells sense and adapt to oxygen availability. So that's the Nobel Prize. As I said, one of the most significant scientific accolades that can be given to anyone in the scientific field. Now, the reason I'm highlighting this as a potential mistake is because of time. Here's an interesting article that was published just a few days ago. And this was done on the 29th of September 2023. Scientists are waiting longer than ever to receive a Nobel. And they're saying that Nobel laureates often receive the prize decades after their groundbreaking research, and that delay is getting longer. So, this is the picture here as to when this is done. And this was in Stockholm Concert Hall in 2008. Look at this very interesting chart here. This is looking at from 1901 to 1910, this period here. And I think I probably use a better pointer. So from 1901 to 1910 here, you can see the time between publication and Nobel recognition at this point here. And in the context of physiology and medicine, it's in orange, physics is in dark blue, and chemistry is in light blue. Okay. And you can see here, and this draws down to the line, this is about 15 years. So from publication to being awarded a Nobel Prize was on average about 15 years between 1901 to 1910. And then they've gone down by decade here, all the way down to 2000, and then the period 2011 to 2019. And at this point here, you can see that for physiology and medicine, the average time is 25 years. That was the average trend. So this is then extremely unusual that within a short period of time, this was then presented to these great scientists for the work that they had done. And let us be clear. I'll bring you back to the actual presentation. This here is the Nobel Assembly awarding the 2023 Nobel Prize in Physiology and Medicine. And it was for the development of effective mRNA vaccines against COVID 19. Let me just highlight that again. Effective mRNA vaccines against COVID 19. That in itself is a huge gamble. Why would I say that? We are currently in October 2023, and based on what is happening across the world, we are now on the brink of another surge of viral infections, especially in vaccinated regions. So to talk about the effectiveness long term, I think is a very, very dangerous precedent. And that's why I'm saying that's one of the reasons why I think that doing that at such a stage, just 2.5 years after the rollout of vaccines in the first major way across a population, without seeing the medium and longer term outcomes. That's the bit that really surprises me. Without seeing medium and longer term outcomes, this is quite a significant step for the Nobel Prize to be awarded. Remember, I showed you it was effectively 25 years. I'll get this here so you can see that again. The normal between 2011 to 2019 was 25 years. This is 2.5 years. What is the reason for that urgency? That's where I am worried about the institution for the Nobel Prize, because if it turns out that there are political pressures that could influence what they are doing, that would be a disaster for this great institution, for something that has been a significant target for scientists across the world. It would be very sad if there were any political reasons as to why this was done at this time. I don't know, but I am just so surprised that they would take a step like this at this point. Now, I don't know what the pressures were, and I suspect one of them could have been about how vocal Robert Malone has been over the past few years. And let me just clarify something. I had the pleasure of interviewing him in June 2021. That was the first video interview that he did. I didn't fully know who he was until after the interview. It was absolutely remarkable. And I recognized that at that point, whilst he was a PhD student, he then came up with the concept about mRNA vaccines. Now, there's a huge step between conceptualization and actually bringing something into being. And this is one of the reasons why potentially he wasn't included in this process. That may have been so, but important for us to understand exactly where the difference came in with why I think the Nobel organization was focused on these two, and it's in the Nobel the in the article today. They were talking about what they did critically is that they found Carrico and Weisman found that by altering the nucleoside bases by using a pseudo uridine, they could then allow the RNA to get inside cells to produce proteins without the unwanted inflammatory reaction. So that was the huge step that they did. That was different from the creation of the idea. And I guess, in a sense, they separated what this was in terms of the work that they did at this point. The Nobel decided that this work was actually so significant that on their own, they were able to get the Nobel Prize without acknowledging the people who had done the work earlier. That in itself is a political decision. And I'm not sure if necessarily that was the right thing to do, but who am I? I'm just observing what has been done. So, the main point to take away here is that without medium and long term studies, and let me make this very clear, from my perspective, looking at COVID 19 or severe COVID 19 as a viral mediated autoimmune disease, this is what I've said right from the start. When you mix an immune response into that process, you have no idea what the longer term outcomes could be. Part of the problem with developing vaccines is usually if you're going to have a problem, it occurs within the first 28 days. Not the case here. And this is because I think fundamentally the science around what exactly is happening with severe COVID 19 has not been fully understood by the scientific community. That's where I think the Nobel institution has made a mistake. They should have waited, given more time. Let the understanding about the medium and long term effects of using this technology at a population level be fully clarified. Not only that, there are many people who have suffered vaccine injuries. How will they be feeling today, having been damaged in some way? And the numbers are quite significant. And so there are many layers that need to be uncovered, not including that about the spread of the lipid nanoparticles. There's so many questions that need to be answered that look at medium and long term safety of this very novel technology. So I think that this could be something that could explode down the line. Let's hope not. And let's hope that today will really be a day of celebration and that 20 years down the line, everyone will look at this period of time as a great period in scientific development. I just wish that we had taken a little bit more time, a little bit more thought, a little bit more focus on the potential outcomes before making such a big step. If you are interested in seeing that original interview, it will be on my Substack, which will be in the link below. Really interesting to hear his thinking at the time. But again, congratulations to Drew Wiesman and Catalina Carico with regards to their position or their award for Nobel Prize. This should be a very happy day for them. And let us hope that that happiness remains in the scientific community in the longer term. Have a great evening.